We are very fortunate, in fact, to have a very long legacy of nursing support within the hospital, within the outpatient department and also within the inpatient facilities. We have none less than 5 key specialist nursing teams, including our own inflammatory bowel disease specialist nursing team. I'm going to talk to you about our biofeedback, stoma and pouch care team, nutrition and endoscopy. And just at the end of my talk, I'm just going to touch upon the other support available in terms of Crohn's and Colitis UK and KICRA, which is the childhood charity. I guess the aim of my talk today is just to highlight the members of these teams and the job that we do, so that when you come in contact with us, that you have an understanding of what we do. So the outpatient service is essentially the face of St. Mark's. This is how the vast majority of you view the hospital, through the eyes of the outpatient department. As you know, it's based on level 3 in St. Mark's. The department includes 11 clinic rooms with 2 further pre-assessment rooms. And the team is led by Sister Denise Robinson, who you may have met, who is organising the stalls down the corridor today. Along with that, she's got a staff including up to 6 qualified nurses and 4 healthcare assistants. And all of those members of the team are needed, given that in any given year there are 55,000 patient appointments within that department, which is quite astounding when you think about it. Within the department, the nurses lead a pre-assessment service, and this is essentially an assessment service for any patients who are being admitted to the ward for surgery. And they also have a nurse-led phlebotomy service. Many of you will be familiar with this as the room that you go to have your bloods taken before you leave the outpatient department. We are very fortunate here in St. Mark's to have a IBD Specialist Nursing team, and I'm very privileged to lead that team with Tracy Tyrrell and Hannah Middleton. Along with that, we have got admin support with Susan Osborne. And we are based at St. Mark's, but we do cover Northwick Park and Central Middlesex, which is all part of the one trust, Central Middlesex Hospital being based in Park Royal, 20 minutes drive from here. We're mainly based in the outpatient department, and ultimately the ethos of our service is to provide continuity of care, support and education, and a point of contact to patients who are under the care of the trust with Crohn's disease or ulcerative colitis. The main point of contact that we provide is via our advice line, which many of you may be familiar with. This is an opportunity for you to ring us, particularly if you're unwell, so that you can be assessed by us over the telephone, and we can provide you with either advice about how to manage your condition at that particular moment, or we can simply arrange for an urgent appointment for you to see your consultant in clinic. Between the 3 of us, we manage about 3,000 calls every year, so we are kept quite busy with it. Along with that, we run a dedicated inflammatory bowel disease daycare unit, which is based within level 4 of St. Mark's, the level above the outpatient department. And this is to provide access to therapies including infliximab and adalimumab. It's by booked appointment only and is open 2 full days per week on Tuesdays and Wednesdays. And within that unit, we see up to 30 patients per week. The other services that we provide, we do see patients face-to-face in the outpatient department for nurse-led clinics, and that's ultimately an opportunity for us to sit down on a one-to-one basis and provide further information or education or support regarding your diagnosis or new therapies that you're about to commence on. Currently, we do also provide support to the paediatric service and to our paediatric gastroenterologist, Dr. Warren Heyer, and those patients who are transitioning from the paediatric services into the adult services. So you're likely to come in contact with us if you have Crohn's disease or ulcerative colitis and you're under the care of the trust, particularly if you're newly diagnosed or about to commence on a new medication. or if you contacted us for advice over the telephone. The next nursing team that I'd like to just highlight is that of the Biofeedback service, which we're fortunate to have here at St Mark's. Irritable bowel syndrome can sometimes occur at the same time as inflammatory bowel disease. Provided we are clear that your inflammatory bowel disease is under control or in remission, sometimes people are still troubled with symptoms such as incontinence or constipation. And in that situation, you may be referred to the Biofeedback Specialist Nurses. This is a nurse-led service which ultimately provides a practical approach addressing the behaviour, because sometimes stress and anxiety, we know, can affect our physical function. And the whole aim of their service is to provide re-education and ensure that you're doing important things like sitting on the toilet properly and employing the right muscles to be able to ensure that you're not troubled constantly by incontinence in particular. The other aspects of their service include several components, including education, bowel and muscle retraining. They get people to modify their diet. They review the medication that you may be taking, which of course can sometimes affect bowel function. There are also practical products that they can provide for management, and as well as providing psychological and counselling support. There's one nurse consultant responsible for the whole service. They have a lead nurse as well as 3 clinical nurse specialists, and they also have a physiotherapist who works as a biofeedback specialist within the department as well. They see on average 1,000 new patients per year, and the normal biofeedback therapy is 4 appointments over a 6-month period, and you then employ the changes that they recommend in between those appointments. Up to 75% of the patients that they see within the biofeedback service are seen directly by the specialists alone, with no medical input, although the team does have direct access to all of the gastroenterologists, the surgeons, a gynaecologist and a psychiatrist, as well as a full range of tests to be able to enhance their ability to treat people. The Stoma and Pouch Care team, many of you will have met them down the corridor today. So just to remind ourselves, I know Mr. Warasavathani mentioned earlier on about a stoma and a pouch. A stoma, of course, is when the intestine is brought to the surface of the abdomen and an opening made so that the digestive products can be expelled into a bag or a stoma rather than through the anus. A pouch, Mr. Warasavathani mentioned as well. This is in the case specifically with ulcerative colitis, where the intestine is used to create an internal reservoir to hold the products before they're being expelled directly through the anus. So you're likely to come in contact with the Stoma Care or the Pouch team if you need advice or support regarding any aspect of surgery, whether you're planning an operation or you're just considering it and need some further information. You're also likely to be in close contact with the team if you need advice and support in managing your stoma or your pouch. The team are based here at St Mark's Hospital. It consists of 1 lead nurse, 3 stoma specialist nurses and 2 pouch specialist nurses, and they're available Monday to Friday. They're mainly focused on inpatient care, but they do also support patients in the immediate pre-operative position as well as the immediate post-operative care. Their outpatient services are limited to those within the local area, so particularly the Harrow community. And they do see patients in the outpatient clinic as well if you are based within the Harrow community. Those of you who live outside of Harrow, you will need to be referred to your local stoma nurse for particular advice and support. Mia Small, you will have just met a moment ago, is the lead consultant for nutrition and intestinal failure. Just to remind you, Dr. Gabe did mention earlier on, intestinal failure occurs when there is insufficient small intestine to adequately absorb all the food and fluid that we need. It's a very rare condition, but sometimes can be a complication of long-standing Crohn's disease. individuals affected, some do require intravenous nutrition, which can also be given via the tube into the stomach, which is known as enteral nutrition. The role of the team here is to facilitate the discharge of patients requiring any nutritional support. They do provide training to individuals or carers so that they can take care of their feeding line if they are on intravenous or parenteral nutrition. For those patients who've been looked after here with intestinal failure, they do have ongoing access via the telephone or via clinic for ongoing support in the management of their feeding line. The team, as I said, is led by Mia Small as nurse consultant, with 2 part-time nurse specialists in nutrition and intestinal failure nursing. As Dr. Gabe mentioned already, the centre here is one of only 2 national centres for intestinal failure, and we currently have the largest cohort of patients on intravenous nutrition. Dr. Thomas Gibson spoke in detail about the endoscopy services available here, and we're also fortunate to have many endoscopy specialist nurses. So as you know, you're likely to come in contact with the endoscopy unit at diagnosis or at any time, in fact, during your care, particularly for reassessment of your disease. If you have colitis, you're also very likely to come in regular contact with the department for surveillance so that we can detect any early cell changes. The nurse endoscopy team consists of 1 nurse consultant and 4 nurse practitioners who can perform independent diagnostic and therapeutic endoscopy. They're heavily involved with the bowel cancer screening programme, and they do work across site, both Centre Middlesex and St Mark's. Finally, the inpatient facilities here are within St Mark's Hospital is Fredrick Salmon ward. Some of you may be familiar with it. We have got a vast team, so we've got 50 nursing staff based on the ward, and it's a 44-bedded unit with approximately 12 admissions per week, so it is busy. There are mainly planned admission, either for medical or surgical management of disease. And just finally, without wanting to step on any toes, I just wanted to mention Crohn's and Colitis UK. From our perspective, managing people with Crohn's disease or ulcerative colitis, Crohn's and Colitis UK provide a fantastic resource and a very reliable point of information. There is lots of information available out there, particularly in the virtual world on the internet. However, a lot of it is not reliable. The information provided on the Crohn's and Colitis website is reliable and is vetted on a regular basis by experts within the field. And I thoroughly recommend that you visit their website or visit their stand today. KICRA, which is the childhood charity, is also available today and do an excellent job in supporting those younger patients with Crohn's disease and ulcerative colitis. We are very fortunate here within St Mark's to have a psychological medicine unit, and you'll hear a little bit later on from Dr. Yoram Inspector, who's going to tell you all about the services to support people living with these conditions. I think it is important, from my perspective, always to acknowledge that sometimes it can be very difficult to cope with a long-term illness. But the support available here through the nurses, but also through the psychological medicine unit, can make it easier for people to manage long-term. Many of you will be hopefully aware of the radar scheme, which provides you with access to all of the disabled toilets across the UK. If you don't know about this, that's the website. You can also get, for those of you who have got a smartphone, you can also get an app on your smartphone which does describe, once you insert your location, all of the nearest toilets based on your location at that particular time. So quite a valuable thing to know about if you have got a smartphone. But equally, if you don't, you can easily get hold of a radar key which provides you with access to all of the disabled toilets across the UK. If you haven't already done so, please pick up a copy of our leaflet, which provides information about all of the services that I've just described in the hospital, as well as the important contact details, so that you can get in touch with us and communicate effectively. So in summary, the nursing staff here at St Mark's are integral at all stages of your care, and you're likely to come across us, some or many of us, at any stage of your journey and interaction with the hospital. There are many avenues of support, and all that you need to do is ask, because we are here to help ultimately. Thank you very much.